Hello and welcome to the Fetal Alcohol Spectrum Disorder workshop. This is modules 1 and 2. I've not done it like this before, but module 2 is quite a short module. Module 1 is quite a long module, and I thought we might as well just add them on at the end, add module 2 at the end. Module 2 is in essence a longer directed task for you. Please feel free to pause it as and when you need to and stop whenever you want. It's only the way I'm delivering it that's different. The opportunities will be there. There's quite a lot of pieces of film footage and things like that that you can make sort of obvious breaks in. So let you know who I am. I'm a TEDx speaker from Disability to Superpowers, which can be found on TED.com and on the YouTube. I'm a Bamford lecturer for the BAA, British Academy of Audiology. I do forensic special education needs and disability work in the courts. I'm an expert witness in SEND court cases. Deliver short courses for the University of Lincoln and Bishop Grosseteste University. And I do training, observations and conferences. It's got quite a wide role. I would say most of my work when I'm delivering the training is combined from my observational work and my research, and so this is very much boots on the ground stuff you get in here today. The basic the basic premise of this is I will share with you what I find to be good, tried and tested practice. You want to be in touch with me? Always pleased to hear from you. You can speak to me on Facebook at People First Education. You can speak to me on Twitter and Instagram, both at Andrew WSEN. LinkedIn, Andrew Whitehouse with some letters after his name. You can email peoplefirsteducation.com, Andrew, and you can also get me on my web presence, peoplefirsteducation.com. So here we are with Module 1, Fetal Alcohol Spectrum Disorder. And behold, thou shalt conceive and bear a son, and now drink no wine nor strong drink. The Bible, Judges 13:7. This is from the Old Testament. I'm using this slide not because I'm a religious person, but because it is testament to the fact that knowledge has been out there for some time, historically, that alcohol and pregnancy are not always the best combination. It's globally recognised that children born of alcohol exposed pregnancies can have lifelong disabilities. We know that alcohol is not good in pregnancy. Advice changes from time to time on when it is and when it isn't safe to use alcohol in pregnancy, but the general consensus is alcohol and pregnancy don't mix well. So if we're looking at fetal alcohol spectrum disorder, we're going to be talking about teratogenic drugs. A teratogen is an agent that can disturb the development of the embryo or the fetus. Teratogens help the pregnancy or produce a congenital malformation, which is better known as a birth defect. And classes of teratogens include radiation, which is why you can't have X-rays during pregnancy, classes of maternal infections, chemicals and drugs. And alcohol is a teratogen, an agent capable of causing birth defects. That's a quote from Jones and Smith, 1973, and you'll be delighted to hear that I don't have to say the word teratogen again in this presentation because I really was struggling with it. But anyway, alcohol is a teratogen and probably one of the most dangerous teratogens. There is no safe level of alcohol intake in pregnancy, and the general advice these days, as we speak, is if you can stop, do stop. Now, by the very nature of the fact that this is fetal alcohol spectrum disorder, and that the cause of fetal alcohol spectrum disorder is mothers partaking in alcohol, imbibing alcohol during pregnancy, then there is the potential for finger pointing and blame. So I would just like to say at this point. Firstly, advice has changed many, many times over the years. I have 4 children, and the advice changed of alcohol intake changed throughout the pregnancies throughout all 4 pregnancies, and it was different advice from one to the other. Secondly, that there are people who, for various reasons, including some health reasons, they may be unwell, don't realise that they're pregnant, or don't find out at all, or later on. So when we're talking about, somebody could be pregnant for quite a while and not discover discover that they are, and then you could also have people that can go through an entire pregnancy and not know that they're pregnant. And so it isn't quite as cut and dry as pointing the finger. There is no universal screening for FASD, fetal alcohol spectrum disorder, in pregnancy. 9.1 births per 1,000 are affected by parent alcohol exposure, PAE. I'm going to go through the little abbreviations a little bit later. And 1.5 cases per 1,000 live births are FASD, which is similar to Downs or spina bifida. So let's have a little look here at what fetal alcohol spectrum disorder is. What is FASD? Okay. Before we go on, I want to share a few bits and bobs with you that you can keep this obviously as a reference point, this slideshow. So FASD is fetal alcohol spectrum disorder. Now, fetal alcohol spectrum disorder is like developmental coordination disorder, is like autistic spectrum disorder. It is the mummy or daddy, if you like, of fetal alcohol syndrome. So fetal alcohol spectrum disorder covers a range of conditions, of which fetal alcohol syndrome is one. So that's one of them. Other ones are partial fetal alcohol syndrome, ARND, alcohol-related neurodevelopmental disorder, ARBD, alcohol-related birth defects. I'm going to mention ARND and ARBD a little bit later. Parent alcohol exposure, neurodevelopmental disorder as a result of parent prenatal alcohol exposure, and the central nervous system is CNS. We're not going to use too much of this, but you might see this in paperwork. You might find this useful to just keep the handout that goes alongside this workshop handy, just for if you're having to do a little bit of research or just to decipher stuff. I know it can be very difficult when these anachronisms show up in documents. So FASD, fetal alcohol spectrum disorder, if we're widening up there, is a blanket term to cover all types of alcohol fetal exposure. Now, fetal alcohol syndrome is quite an easy one to spot if you're looking for it. They have different facial features, growth problems, central nervous system problems, learning, memory, attention, communication, vision, and hearing, and it's the physical representations, of which I'm going to show you some photos as we go along that we can discuss. That makes it the easy one to find. PFAS, which is partial fetal alcohol syndrome, a lot harder to spot because they lack the growth deficiency or full facial dysmorphology. They do still have a certain amount of central nervous system defects, but they just don't have those faces that you would associate with fetal alcohol syndrome. So a couple of other ones here. Prenatal alcohol exposure is one you're going to need to know, and neurodevelopmental prenatal alcohol exposure is the new terminology for alcohol-related neurodevelopmental disorder. So lots and lots of things to take in there. Fortunately, you don't have to remember all these because I've put it all down on a piece of paper for you that you can reference to as and when you wish. Now, alcohol-related neurodevelopmental disorder. Most of it affects academic, behaviour, learning, maths, memory, attention, judgment, impulsivity, whereas alcohol-related birth disorder is heart, kidneys, and basically internal organs. Now, if you look at the hand there, we've got a hand on the screen, and on that screen, that hand has got what is called a simian line. And if you look at my hand, okay, so can we see that okay?
You can, yeah.
You'll see that there are two lines going across the hand, there and there. I'm wondering, can we get your hand on there?
Come closer.
Yeah. Okay, and if you see our producer Isaac's hand, he has one line that goes across there. This is very rare. Thank you very much, Isaac. Could that be seen on the screen, do you think?
I think
right.
so.
So, Isaac has a hearing defect, and when he was first taken to be checked as a baby about his hearing problems, he's got auditory processing disorder. And when he was being checked, first thing that the specialist looked at was his hand. And we said, that's interesting. Why are you looking at his hand? Well, we then found out that hands and ears form at the same time. Hands and hearing form at the same time during birth, during pregnancy rather. And so one of the things that they do is they look at this and they say they got the simian line. I do not have a simian line. I have what is considered as typical. I have the two lines. The point I'm making here is quite a good one, is that you can be drinking very, very heavily during pregnancy, and you can be extremely lucky and not have a child with any kind of FASD. Or you could just have one light gin and tonic maybe on one day during a crucial time during the pregnancy, and you could end up with some kind of defect. And the reason I was showing that simian crease and talking about the auditory processing disorder is that they often things develop at the same time, and as long as you miss these things, but you know, there's no way of judging, there's no way of doing this. Tony Blair's got a simian crease, by the way, a simian line. Fetal alcohol spectrum disorder. This is not a diagnostic, but it is a term which describes a range of mental, physical, neurobehavioural birth defects resulting from alcohol-exposed pregnancy. It's one of the leading causes of preventable birth defects. Permanent brain injury to the developing fetus. Alcohol enters the bloodstream without filter, without barrier. It just goes straight in. And it's more dangerous than most narcotics that you can take during pregnancy. So that's essentially what's happening there, is the alcohol is going straight in through you know, straight through into the baby without any filter, and the fetus, of course, does not have a fully formed liver. Now, this is, again, when we look at fetal alcohol spectrum disorder or fetal alcohol syndrome, the comparison is, you know, that you hear of people, pregnant women, they eat a curry and they go, oh, the baby's going crazy in there. Yeah, because the baby's got wind. Whatever you take is going straight into the baby. And you also hear about people who have certain cravings, and we then find out that those cravings are related to the birth, to the development of the fetus. So somebody that craves lots of vitamin C may find that they have a child with eczema or something like that. Fetal alcohol syndrome is marked by craniofacial abnormalities and a small head circumference, including a small body as well, so growth deficiencies and difficulties, and it's better understood due to the physical appearance. Now, let me just show you that. So we have a growth delay in weight, height and head circumference, altered form and facial defects. So I'm going to look at that picture there. you can see that that young person here has got a very distinct bridge of the nose, the shape of the eyes, lack of philtrum here, the philtrum being the two lines that you have down there. And that is quite an easy thing to spot if you're working in a school environment, if you know what you're looking for. Obviously, if you don't, it doesn't jump out at you. You just think that they're just slightly different looking. But if you know this stuff, that's things you can be looking out for. We've got some really good ones up here that are sort of showing the variations, but the general theme remains the same. The one I look for is the bridge of the nose and the smooth philtrum. I look for that first, and I quite often, you know, I will get quite up close because sometimes it's very, very difficult to tell. These are good photographs, but sometimes it can be very hard to work it out. I have been called in to school environments to observe children, and I will share with you something that really I don't enjoy, but always happens to me, is I will have a professional and they try to test me, and they'll say, I'm not going to tell you which child it is, Andrew, see if you can work it out. You have no idea how much I hate that. I feel it's kind of wasting my time, but anyway, this has happened on 2 occasions in particular where I have then gone, yes, I think I've seen the child you're talking about here, and I think that child has fetal alcohol spectrum disorder, fetal alcohol syndrome. And actually what we've then found out is it's A, not the child that I've been supposed to be looking at, and B, yes, it did turn out to be FASD or FAS. And in the last couple of academic years, I'm going to say, to be on the safe side, I have identified 2 separate children with FAS who have gone on to have full diagnosis. So, fetal alcohol spectrum disorder, poor attention span, this is some of the neurological difficulties, hyperactivities, moodiness, learning disabilities. Now what you're thinking there, I know what you're thinking, this looks like something else to me. How can I tell the difference? So we're going to go through these few slides and then we'll talk about that. I'm not going to do a spoiler alert for you. So under fetal alcohol spectrum disorder, there are other conditions that are less well known due to the different physical appearances. And even though we've got all the neurobiological things going on, the physical appearances is not there. So fetal alcohol syndrome, FAS, is the easiest one to spot because we do have those physical differences, physical abnormalities. Okay. Fetal alcohol syndrome children can be much smaller in size. So I'd love you to have a little look at this picture on the screen and say to you, tell yourself how old do you think that child is. Let's give you a few moments to think about that. You can pause if you want. Okay. Rather shockingly, this boy is 15 years old. Okay. There we go. This boy's 15 years old. Slides are running a bit tricky for me at the moment, but we'll soon catch up. So that's quite a shock, really, isn't it? Because of the size of him. Some primary symptoms: you might have behaviour disorders, you might have temper tantrums, unacceptable behaviours, socially unacceptable behaviours, academic difficulties. These are the things, and these are obviously the things that get me called in to your school, if indeed you are observing from a school. Now, I'm always picking up on things. Fetal alcohol syndrome has more of its publicity is online than it is in books, and so there's lots of interesting things out there. And one of the things I came across this morning while I was kind of swatting up, and I thought, oh, we ought to have this. Some of the common behaviours of fetal alcohol spectrum disorder students, and I read it through, and you can read it through in your own time. I'm not going to read it out to you. I thought, this is just like any other student or pupil that we might have. You know, all our pupils behave like this at some point or another, and that's again quite tricky to navigate, because How are you going to spot that child, particularly if they don't have those FAS features? Worth knowing as well that if there are twins, quite often twins may not both be affected in the same way. So you've got twins here. One clearly has difficulties, one is looking a little bit more typical, and this does happen and can happen. fMRI, which is functional magnetic resonance imaging, has identified structural alterations in brain size, shape, symmetry in individuals with fetal alcohol syndrome and indeed fetal alcohol spectrum disorder. So on the left there, you've got a neurotypical brain, and on the right there, you've got an FAS or an FASD brain. Now, that I find most disturbing, but what it does tell me is that FAS and FASD are brain damage as opposed to neurodiversity. And as a result of that, some of your strategies may not be as effective with them. I'm going to look at that as we go on a little bit later, but that's the explanation why they're behaving in the way they do. So I've been working on dyspraxia training as part of this series of workshops, and the dyspraxia training, we say we know of no causes, whereas with this we can see the cause, we can see the actual shape of the brain. People with FASD have inconsistent memory and recall, slower inconsistent memory and recall, slower inconsistent cognitive auditory processing, co-occurring mental health problems, that's for real, hypersensitivity, emotional regulation difficulties, low self-esteem, impulsivity, and difficulties with rules and regulations. So we clearly got challenging behaviour in there. We've clearly got learning problems. And when we go back to the shape of that brain, that really does explain it, doesn't it? That's the reasoning behind that. Motor coordination difficulties, sleep and eating disorders can be part of it. Lack of social understanding and the big picture, the knock-on effects of what they're doing. Now, here it is. What is the problem that educational professionals will have with this? Or, in other words, what does FASD look like? I can almost hear you shouting at me. Autism and ADHD. Yes, absolutely. And in particular, ADHD. I say that actually, it's a good mix of both, really. It really has got striking similarities to autism and ADHD. The diagram on the left there is autism, diagram on the right is ADHD. So we have that lack of social understanding, sensory problems, communication difficulties, rigid thinking in autism. We have problems paying attention in ADHD, impulsive behaviour, hyperactivity. And you can just see why people will think, oh gosh, that's just that's a person with autism, especially when it's not FAS, when it's FASD. So hopefully we can get this to click on. We've got a problem here.
Ugh. I want you to try it.
No, we're going to have to pause this. Excuse us, folks. We're going to pause.
3, 2, 1.
Hello, welcome back. Well, we seem to have fixed our technical problem. So let's look at the major effects of alcohol by trimester in pregnancy. Most developmental dysfunctions and destructions happen in the first trimester, the first 3 months. And of course, in the old days, they used to say there's no alcohol in the first trimester, but you're pretty okay with lower levels of alcohol in trimester 2 and 3. Well, we know that not to be true now. In trimester 2 now, what we talk about is increased risk of spontaneous abortion, i.e. miscarriage, and in trimester 3 we can have damage with decreased fetal growth. So that's worth knowing there. We also have, if you remember your little red book, if for those of you who've had one, if your little red book, it got your charts that said where the weight should be, where the height, the length should be. So what we want to look at here is on that particular chart here, what we've got is the thin line is FAS and the typical line is the wider one, and actually FAS is way below in length, weight and head circumference. So again, worth looking at. So gosh, got a little bit confusing there again. First trimester, alcohol has the ability to cause significant destruction to cell development, has devastating results. The most serious being, of course, spontaneous abortion. Second and third trimester, we have the central nervous system and some other organs and systems can remain susceptible. And again, the message is there really is no safe time to drink alcohol in pregnancy. Other areas of development might be eyes, ears, tooth enamel. So you might have problems with sight, you might have problems with hearing. And again, we've got tooth enamel here. This is quite an interesting one. A lot of people don't realise this until I tell them that the teeth aren't formed properly and therefore you get rotten teeth. And it's not necessarily neglect. It is just part of the fetal alcohol syndrome. So there we go. Right, I'd like you to watch a video now. This is a TEDx video, and it's called Fetal Alcohol Spectrum Disorder Impacts You, But You Don't Know It, by Nora Bosom. And we've got the link there, so if you've got the electronic copies of the handouts, then you should be able to click on that. If not, do get in touch. But she's going to talk about some of the impacts of fetal alcohol spectrum disorder. So enjoy. Welcome back. Hope you enjoyed that. It's quite a moving piece, isn't it? So, interventions. Fetal alcohol spectrum disorder performs significantly lower developmentally. They will have a lack of social skills, impulsive behaviour, and troubles with concentration or inattention. So we've got all these different things going on in the FASD brain, and obviously, you know, there's more than just 2 or 3 things. Quite a lot of stuff going on there. Some of the things that you might not realise, for example, breathing problems is in there, heart defects, hearing problems, memory problems, dental problems, which we just discussed. So a heck of a lot of stuff going on in there. It's often misdiagnosed as ADD, attention deficit disorder, ADHD, ASD, autism, dyspraxia, oppositional defiant disorder, and pathological demand avoidance syndrome. This could lead to medication because the presentations are so similar, and that medication would of course be mismedication, be the wrong medication. And you don't need me to tell you that if a child has the wrong medication, then this is not a healthy thing for them. So this is your problem. It looks like autism, it looks like ADHD, it looks like PDA, but the interventions that you're giving them are probably the wrong ones. Traditional interventions probably won't work, and this, things like behaviour modification, therapy, counselling. The problem is the brain has got sustained damage, and so what works one day might not work the next. There is an actual physical difference to the brain. It is a different brain. Okay. With minor alterations in the environment, language and expectations, we can achieve accommodation. We can get things done for them. But these interventions need to be tailored for a brain injury. Diagnosis does not change the child. It just helps us to understand them. Excuse me. And so diagnosis doesn't change the child, but I'm going to start this slide again. The diagnosis does not change the child. It does help professionals, carers, parents to understand and understand the neurobehavioural challenges. And obviously with any condition, the most effective thing you can do is to understand the condition. The diagnosis is more important there to help us to obtain a care plan, which then provides the appropriate interventions. Diagnosis recognises the disability, and we do come across professionals, education professionals, that that find it very difficult to put interventions in place without seeing something on paper first, some kind of diagnosis. So what I'd like you to do now, we have another film. It's only 2 minutes long. It's a very good film. It's called Living with Fetal Alcohol Syndrome. It's an American film, and it's where this family are discussing the process of the diagnosis and what that diagnosis meant to them. So I hope you enjoy that, and I will see you in a few minutes. Welcome back. You'll be pleased to know that I think I've sorted out our technical problems. IT, huh? It's a difficult one there. Okay, so areas in the brain that are affected by fetal alcohol syndrome and fetal alcohol spectrum disorder are the corpus callosum, the cerebral cortex, and the hippocampus and the cerebellum. So that's the three major areas that have been affected by it. The facial dysmorphic features, I want to talk a little bit about the mouth again. I've discussed with you the philtrum, the smooth philtrum, and how I have to get right up close to see it. But also we have a thin vermilion, the mouth, the lips. Lips tend to be a lot thinner. So that can be quite tricky with very young children because they're not maybe fully grown there. But yeah, facial dysmorphic figures, quite easy to spot, quite easy to recognise. Other facial dysmorphic figures, as you can see there, the opening between the eyelids are quite considerably smaller as well. So you would be looking for that. Remember though, you are not in a position to diagnose, you are in a position to identify issues. Please do not under any circumstances call a parent in and say, I think your child's got fetal alcohol syndrome or something like that. That would be particularly unhelpful, and it's not within your remit. You would pull up what you've noticed, and then you would advise that parent to go and get medical advice. So deficits and disabilities, a cognitive or developmental deficit or disability. So we get specific learning difficulties, particularly in mathematics, again, and visual spatial deficits, uneven profile of cognitive skills, poor academic achievement, discrepancy between verbal and non-verbal skills, and slowed movements or reaction to people and stimuli. Deficits and disabilities continued. We would have executive functioning deficits, poor organisation skills is quite a common one, planning and strategy use, lack of concrete thought, lack of inhibition, and difficulty grasping cause and effect. Have a look at this little activity that I put together. I really like this. It's you can do it with flashcards, you can make it yourself. Again, it's quite American. A lot of the good resources we've got for FASD are American, but there's nothing to stop you taking the ideas here, altering them to meet your needs. So we would want to match the cards together. So card one is I pushed down on the stapler, and the answers we've got is the students listened, he made the winning shot during the game, the papers are stapled together, the customer ate the fresh salad, and the squirrel had plenty of food for the winter. Clearly, I pushed down on the stapler, the papers are stapled together, and that's to help with that concrete thinking. And so, really good little thing that you can do. You can make your own, you can build them around special interests if you want. You should get a lot of success from that. Other areas are inability to delay gratification, difficulty following multi-step directions, difficulty changing strategies or thinking of things in a different way. Either, they will persevere in a particular response even though it doesn't work, and The other thing is that you would get a certain amount of rigid thinking in there, is that if you want to make changes in their daily routines, you might find that they don't really like that and they find it difficult. Poor judgment, and also difficulty applying old knowledge to new situations. And so that lack of flexible thinking there, and that single attention. The other thing you'll find is that there are motor functioning delays, and so your Birth to 5 books, of which there are many, we've got one on the screen there. That's not one that I've ever read. The one I remember was Mary Sheridan, and also the one the NHS give you. Delayed motor milestones, difficulty writing or drawing, clumsiness, balance problems, tremors, poor dexterity, and in babies, very interesting, a poor suck. One wonders how much that's got to do with the shape of the lips and the smooth philtrum. Other areas: attention deficit, hyperactivity, busy, inattentive, easily distracted, difficulty calming down, overly active, difficulty completing tasks, transitions, and inconsistent attention. Poor social skills. This is quite a common one. Lack of stranger danger, in much the same way as you often see in Down syndrome children. These children are often the scapegoat for other children because they have that naivety and that gullibility. So they're easily taken advantage. They may choose the wrong friends. They may actually prefer to be with younger friends. They may present with immaturity and superficial interactions. So again, the social skills and the social side is something that you've got to put lots of help and intervention into. But because of that damaged brain, it may well be quite tricky to do that in a consistent manner that they're going to keep hold of on a regular basis. Adaptive skills can be significantly below cognitive potential, and we can also get things like inappropriate sexual behaviours, difficulty understanding the perspective of others, poor social cognition, and significant, and I mean significant, inappropriation initiations or interactions, and these could be verbal, these could be physical, but they are nonetheless inappropriate. Other sensory problems: you could have tactile defensiveness, oral sensitivity, pragmatic language problems, difficulty reading facial expressions. We could be putting in lots of resources for that. It's something that I would do a lot with. Poor ability to understand the perspective of others, and memory defects, e.g. forgetting well-learned material. Now, this is again particularly of interest to me. It's the teacher's worst enemy, really, because what we've got here, we've got a situation whereby you teach them something on the Monday, it's gone by the Tuesday. I remember I used to teach a boy in post 16 who was very, very good at maths. You would teach him maths concepts and he would have lost those concepts by the end of the lesson. And he was actually a child with brain damage. Not this kind of brain damage, but certainly something that would have the same sort of presentations. Not understanding cause and effect, as we covered earlier, difficulty responding appropriately to common teaching, parenting practices, and not understanding sanctions, that you've done something and that may have got you into a little bit of trouble. So again, this is an American resource, but it's a good resource and I think you'll enjoy it. You can change this. All you've got to do is change the picture there to turkey and Christmas, but the event, you eat me for Thanksgiving, or you eat me for Christmas. Now what we're doing here, we're not matching them up in the same way. What we're doing is we're just writing a list of effects. So the event is you eat this turkey for Christmas or Thanksgiving to our American cousins. What is the effect of that? Well, the effect of that is you might put on a little bit of weight. The effect of that is you might feel full and fall asleep with a baby on your chest and a paper hat on your head. It might be that you realise that there is one less turkey in the world, and it might be you eat me, you might not want any supper. So there's all these different things behind that, all these different effects behind that, but it's getting them to see that cause and effect Great little activities. Can't recommend this sort of stuff enough. Now, sensory processing dysfunction. We want to talk about that because sensory processing dysfunction is definitely one of the fetal alcohol syndrome and fetal alcohol spectrum disorder presentations. So obviously we have senses, they help us make sense of the world. Now if the limbic system or the prefrontal cortex is damaged, this doesn't happen in the normal way. We're not able to send clear messages or impulses through the neural pathways, and so the messages can't be interpreted correctly. This could lead to all sorts of difficulties. For example, if you're touching something hot, you may not realise you're burning. You might go out on a cold day, forget your coat, and it's not until you become unwell or hurt that the problem is discovered. So, you know, sensory processing dysfunction, very serious issue and something that they may need a lot of support. Signs of this might include unusually high or low activity levels, over or under sensitivity to information from the senses. So you might be too hot when you touch something, issues with the texture or flavour of foods, making them a picky eater. We do get a lot of people, very similar to autism, who struggle with spicy foods and may eat lots of bland foods and may eat, and just because they're painful in the mouth. And we do know that that has a knock-on effect to bowel problems. Also, gross motor sensory excesses such as spinning, swinging, rocking and things like that. Aversion to touch such as hugs, hair, teeth brushing, tags in clothes. And again, we see this kind of thing in autism. So it's easy, very, very easy for people to confuse these things with each other. Moving along here, we've also getting overexcited and struggling to calm down, being distracted, finding it difficult to focus on a task, and struggling to fall asleep and stay asleep. We also have clumsiness, bumping into and tripping over things that might well be just in front of you. Okay. Other ones are unusually high or low activity levels, over and under sensitivity to information from the senses, issues with the texture and flavour of foods, which I've just done. Why did this? Okay. I thought that was going on a little bit longer than I expected. We're having a little bit of problem, but we're close to the end of this module, so I really would like to stick with it if you were okay with me. Therapeutic strategies, we want fidget toys that help them sort of get those movements going. Quiet areas to go to give them brain breaks, somewhere to rest. Ear protectors, MP3 players, tinted glasses, anything sensory. Movement breaks, allowing them to get up out of their seat. Okay. So I know a lot of schools have banned these items, fidget spinners and fidget cubes, which we have here. That actually just looks like a load of fidget buttons floating in space, but it is actually a fidget cube. They are banned. But under the right circumstances, they're a very efficient tool for people with fine motor hyperactivity. The classics, blue tack. Blue tack's a really good one. I'm all for that. It's a nice, cheap, easy thing to put in place. We might put in place soft, fleecy materials for clothing with tags removed, generous, oversized clothing, heavy blankets. We've got, weighted blankets, weighted collars, that sort of thing. Putting a fan on to create white noise to help with sleep, or even putting a radio on. Putting a radio on for children to go to sleep to helps them acclimatise to noises. Children who sleep with a radio on, I can tell you now, become fantastic campers. But putting on that background noise to help them block out other things, to help them focus on one thing. If we're looking at environmental considerations, learning with fetal alcohol spectrum disorder can have difficulty perceiving extreme temperatures, visual, spatial perception and balance, actually navigating through spaces. A learner with fetal alcohol spectrum disorder might be distracted by colours, smells, noises. It might be clutter, noise from outside the classroom, humming, heaters. And I just recently, actually, in a school in Cumbria, had to get them to turn their heating off in the reception class because it was so loud, and you just couldn't work with it because the children couldn't concentrate on what the teachers are saying. In addition, learners with fetal alcohol spectrum disorder can be disorganized. They might need help following timetables, routines, and they might become really frustrated. And they might also have trouble making transitions from one activity to the next. I know what you're going to say. Is he going to be mentioning visual timetables? Yes, I am. Yes, I am. And timers. Okay. There are other issues that need to be taken into consideration. For example, higher than average incidence of other medical concerns. So we talked about breathing problems, we talked about heart problems, we talked about hearing problems, and these can obviously be addressed by adapting the learning environment, particularly visual and hearing things, hearing disabilities. So neurological conditions such as seizures, impaired bones, joint development, that sort of stuff as well, can be really prevalent in people with FASD. People with FASD become easily overwhelmed in everyday situations, and that might give you inappropriate behaviours, disorganised, aggressive, self-abusive behaviour, and this stems from an under-aroused or aroused central nervous system. In other words, they can't help it. They don't need you to put a sanction in place, they need you to understand them. Sensory processing deficits can result, poor modulation of arousal and alertness, resulting in emotional instability, hyperactivity, behavioural disorganisation problems, and the classroom again can provide that structure if we can take that into consideration. We can also reduce visual and auditory distractions, calming colours, spaces in the classroom that can be calming areas, reduce the brightness, turn the lights down, or if we could just have one little place, and you've heard me talking about things like tents or calm down zones or all that kind of stuff, that would be great, really, really helpful. Moderate heating and ventilation, again, if you've got a sort of situation where they can get too hot or too cold, have an area where they can go and cool down, have an area where they can go and warm up. Some of the things that we can do for people with FASD is really, it does come across as a lot of doom and gloom, but some of the things that we can do for these young people is get them looking after something. So looking after a plant can be very good. We learn lots of social skills from learning from a living thing. I would get a plant that grows quickly, nice big cheese plant that they can actually watch leaves forming and things like that, and that happen overnight. I would really recommend one of those. A fish or a couple of fish in a fish bowl. Again, learning that understanding of looking after another life is extremely helpful. Feeding it, cleaning it out with assistance. Maybe even a rabbit. So there's lots and lots of things you can do with fetal alcohol spectrum disorder. It just takes a little bit of thought behind it, really. But yeah, pets and plants, encouraging the learner to assist with taking care of these living things, provide tons and tons of social skills. Okay, so some helpful visual strategies, visual timetables, choices cards, stepping stones, blob tree, 5-point scale, social stories. You've seen me use all these things. Very unlike ASD in one particular way, though, that the imprinting is less likely. You've got to do these things more and more and more. So, stepping stones, making them aware that there are several stages to many operations, but if you complete these stages, that you will get to where you want to be. Seating learners, if you put them in, front, middle, or giving them peer role models, having a U-shaped classroom, getting rid of any unnecessary distractions. All this will help. I've said it before, away from doors, windows, noises, and visual stimuli. Okay. Make sure there's a purpose to any displays that you have. Do not use too many colours, no many busy patterns, all that sort of thing. Soft colours make it more calming. And what is the point? Have a look at your displays. I used to say there were 3 reasons for a display: to stimulate learning, to celebrate learning, or to have as a learning resource. But you know what? There's a 4th element: is can they understand them? And I do go into classrooms that have displays, and I think, does anyone know what this is about? Let alone what it's for. And then you could possibly even cover displays that aren't in use. Try to sort of put them in a position where they're not having to deal with noises from other groups. So I particularly remember one where I went into a reception class, and the teacher there was teaching about Wales, the country Wales. But whilst that was going on, right next to the speaker, there was a learning support assistant making Valentine cards with groups of children, and the children watching the video couldn't hear the video. So it might be that you plan where people are going to be a little bit better. It might be that you plan when things are going to happen a little bit better, and I understand it's not easy. Or you might have some kind of system with headphones. It's up to you, but you need to do something. Have lists of vocabulary out there so that they can become acclimatized to things. So if you're looking at a new topic, you might say, right, okay, we're looking at history, we're looking at the Tudors, we want some Tudor words. So what Tudor words are we going to be putting up? Put up all your Tudor words on the wall, like Hampton Court, like Henry, like Elizabeth, like crime, whatever it is, religion, Catholicism, whatever level you're at, and put those up on the word so they can acclimatise this. People with FASD, they have a difficult time with abstract ideas and language, so put things out as well, things that they can touch. So if you're teaching about Diwali, have some Diva lamps out there, have some statues out there, have some Hindu artifacts out there that they can have a little play with. Okay, thank you for listening to module 1. No, we're carrying on. So our producer here is getting ready to click stop. We're now going to look at module 2. You, of course, are able to pause, but we're going to carry on through here. Apologies for the few little technical hitches, but that's IT for you. It happens all the time. Hopefully we'll have it fixed for the next workshop. So what I want to do is talk to you about starting school, and I want to set you a directed task. Starting school, the big schism. The child is discovering how to be away from the parents. Yeah, it might be the first time they've ever been away from parents. They're going to be in a much less predictable environment. I can remember when I started school, one of the things that I noticed first was not everybody was nice. That was a real shock to me. Alongside different children, different adults, less focused adult supervision. You may be in a class with two or three, if you're lucky, teaching assistants and a teacher, but there might be 30 kids there, and a broader social circle. This is going to create additional challenges for the child with FASD, who needs prompts, instructions from an adult to help them understand. They've got to be able to interact with their peers. They've got to be able to interact with their helpful adults, but also they're going to need to do this independently, more independently. So it is quite tricky. I mean, most children, they will adapt naturally. You might need a little bit more input here. This is also where the gaps are starting to get a bit wider. If they've not been identified, they might be starting to be identified more. I'm going to remind you again, Special Educational Needs and Disability Reform Bill says that that it's not, you don't have to have a diagnosis, that they're looking for interventions for children who may have SEND, and therefore we're looking for putting things in place for children who may not have that diagnosis, but you're going, there's something there, and I think we need to, need to put something in place. You have a legal obligation to do that. Some of these kids may still be dealing with earlier delays in their development, and may still be dealing with other challenges: sensory, sleep, social skills, language communication, emotional dysregulation, short-term memory and attachment disorders. And again, we've got a whole module on attachment for you to make use of. They're there in school, they've come in, they're struggling with the physical activities, the jumping, the running, the PE. They might not be able to hold pencils and pens and crayons and all that kind of thing, and they may well not have those skills. And of course the parents, particularly if they are parents and have only got, this is their first child, they may not be aware that this child is behind with their development. So they might have difficulties with two-step instructions, words like in, on or under. Other people may not be able to understand what that child is saying to them if they've got speech problems, and you might have difficulties with social interaction. Playing with toys can also be an issue. So they might not be playing actively with their toys or amusing themselves, and may rely on others to help them. So we might not be getting the self-initiated play that we expect when we're starting school. Some of the development may even be going backwards, and they seem to have picked up skills at one point and they lose them a little bit later. Not only are we dealing with these issues, but we're going to be possibly getting new issues coming up all the time. So this is a fantastic video. It's a little bit longer than some of the others. It's about 8 minutes long, and this is by an educational professional who is also the mother of 2 children with fetal alcohol syndrome, and she's going to talk about some of her ideas that help you with settling a child into school. As I say, it's going to take you about 7 or 8 minutes, and then you've got then you've got your activity. Here is your directed task. I want you to build a child. I want you to have read through what I've said, and then go through what the video has to say, and then I want you to give that child a name, and I want you to choose 10 attributes from starting school. How are you going to make starting school better for this child? I wish you good luck with this. If you want to be in touch with me about this activity, I'll be delighted to hear from you. Thank you very much for being part of this video, and thank you so much for putting up with the few little technical hitches. I don't think they were too bad in the end, and I think we need to thank Isaac for getting them all sorted for us. See you on the next module.